Welcome to this week's episode of Confessions of a CX Executive. I'm your host, JP Dumas. We often think about healthcare. We don't often think about CX. So my guest today is Indrani Halder. Oftentimes we talk about how complicated healthcare is. What are some of the pain points that you see in healthcare?
You go to the hospital when you are sick, when you're vulnerable, when you're not at your best. Hearing a lot of things which apparently do not pertain to your care or are perceived as barriers to your care. I cannot say that the complexity justifies bad customer experience. Think of the complexity of when you're traveling in the airport recently with all the multiple cancellations. We all have to understand that each of us has the agency to calm things down. At a point in time when I make that choices, I often don't have all the information I need. My first question, and it's happening to me right now because employer-sponsored health plan that I avail of is changing. So the first question that came up was, is my PCP part of this network? Engaging the human in their own healthcare is pretty difficult. The young and the healthy are invincible. We're all executives by day and humans by night. Would you want that same experience for yourself or your most beloved family member?
You're really running something that's based on systems, right? It's just volume. Welcome to this week's episode of Confessions of a CX Executive. I'm your host, JP Dumas. As many of you know, I've spent more than 2 decades running sales and customer operations for some pretty big companies you've heard of. And now, as founder and principal at CX and Growth Strategies, as well as a partner at CX on the Rocks Collective, we focus on helping small and mid-sized companies improve their customer operations and their contact center experiences. Today, we're going to do something a little bit different. We're going to jump into the world of healthcare and customer experience. Now, when we often think about healthcare, we don't often think about CX, if we're being honest. But I have someone on today who might help change our perception of that. So my guest today is Indrani Halder, actually Dr. Indrani Halder, who has spent several decades in this space that we call healthcare, helping companies sort through policy and compliance issues. So she's here to talk about what works, what doesn't, and more importantly, how to elevate the experience. So Indrani, thank you very much for joining us today. And I'd love to jump into our conversation because oftentimes we talk about how complicated healthcare is, but I think you have some myth busting that you can do for us. So before we jump in, tell us a little bit about yourself and what you're doing these days.
Thank you, JP. It's a pleasure to be here. I'm really looking forward to our conversation. Well, I'm Indrani Halder, based in Pittsburgh, Pennsylvania. And most recently, I am running my own healthcare consulting company, Fortuna Solutions, through which I serve health plans and digital health solution providers, develop solutions that are very critical to make sure that healthcare is accessible and affordable to everyone. Prior to this, I've held leadership roles at Fortune 20 healthcare organizations, where I focused not only on improving clinical operations, as well as building new digital solutions to scale care delivery, make value-based care more accessible, improve the payer-provider relationship through automation, digitization, and more recently by deploying AI at scale. Prior to that, what I am at my core is a population health researcher. I was a tenure track faculty at the University of Pittsburgh School of Medicine, where I led my own research team. I had independent NIH funding to support multi-site clinical studies looking at causations of diseases, primarily through the lens of genetics, behavior, and the interactions of genes and behavior. You are spot on. Healthcare is what I have always known and done. And this is where I find purpose and passion for doing the work that I do every day. But I have evolved from trying to understand what causes diseases and how to cure diseases to focusing more on, hey, how do we make the care that is available today accessible and affordable so that anyone who needs it can get it when they want. Now, payer was an interesting pivot in my career, but more on that as we talk about, as we have our chat today.
Yeah, absolutely. Well, first of all, as mentioned, you have an impressive background. So I thought you'd be a great person to bounce these ideas off of how do we make the healthcare experience better, and as you mentioned, more accessible. So let's talk a little bit about what it looks like from the inside. Since it is such a unique beast, tell us, what are some of the pain points that you see in healthcare that hit patients over and over again?
The number one pain point is who takes care of the people who provide care. So who supports the doctors and the nurses who are delivering care to the patients? Are there systems, processes, and workflows in place that make it easier for them to do their work? Or have we inadvertently introduced systems and processes that make the work more cumbersome? And I know that opens a can of worms, potentially. But at the end of the day, like many other industries, those who provide the service need to be supported so the service provided is of the highest quality.
Yeah, that's absolutely one of the most critical pieces. It's, we think about the service delivery aspect of it. Those are our unsung heroes on the front line. But one of the criticisms we often have of healthcare is that it's just too complex. But is complexity the real issue, or is it how we respond to it that makes it complex?
It is both. There is no denying that healthcare in the US is complex. In our efforts to make sure that the most vulnerable in the society get the support they need, we've got some great systems in place. The CMS is truly a one of its kind organization that has, moved mountains. It has introduced a lot of good things. Inadvertently, the variation created where you now have Medicaid, Medicare, multiple variations within, and the different commercial plans that support managed care, understanding and following all of those rules makes it a very complex process. And yes, the way we respond to it is also, adding to that. Now, that being said, healthcare isn't a luxury. It's not something you go after because it's a nice, beautiful day and you feel like getting healthcare. You go to the hospital when you are sick, when you're vulnerable, when you're not at your best. And to then run into challenges creates a lot of problems. And so as a patient, when you're coming in and you're hearing a lot of things which apparently do not pertain to your care or are perceived as barriers to your care, you get frustrated. And so doctors and nurses are bearing the brunt of it because they have to not only take care of the sick, which is what they are trained to do, but they have to maneuver the administrative processes, pay attention to the rules, all of the new technology that is being thrown at them, and meet the hospital administrator's requirements.
Yeah, absolutely.
So it's hard.
Yeah, it is. And one of the things that you touched on was important because it's when people are most vulnerable, and a bad customer experience can have catastrophic outcomes. I think we all recognize that. But I want to go back to this point about complexity. Does the complexity justify a bad customer experience, or is it just an excuse for awful experiences that happen throughout the system?
No, I cannot say that the complexity justifies bad customer experience. We've been in parallel situations. I mean, think of the complexity of when you're traveling in the airport recently with all the multiple cancellations, you've got irate customers, and there are still, airline personnel who are trying their best, and some are responding in positive ways where they're managing situations better, and some are not. So the same applies to healthcare. The added complexity is if it's a life or death situation, a claim denial, for instance, or an authorization denial, things can accelerate and exacerbate very quickly. Then it gets into the papers, and then some entity is portrayed as a bad player in that, right? the context never justifies how people respond, but at the same time, we all have to understand that, each of us has the agency to calm things down versus responding and reacting instead of responding. Right?
Yeah, I love that analogy of understanding that there are people who are quote unquote in the fight and are working with the tools they have to alleviate the frustration. So that's a great call out. I want to talk a little bit about something that is near and dear to each one of us. As we get towards the end of the year, we all have to struggle with this thing called open enrollment, switching plans and whatnot. What are some of the most common micro frustrations that patients suffer? And again, bring up open enrollment because that is just like, I don't know, A, B, C, I don't know, one of these will work.
Absolutely. Sometimes choice is a bad thing. Now, as a patient, or even as an employee, if I have an employer-sponsored plan, and I'm looking at, okay, I have A, B, C to choose from. Here are the deductibles, here are the services, etc., etc. At a point in time when I make that choices, I often don't have all the information I need. And as a patient, my first question, and it's happening to me right now because our health plan, employer-sponsored health plan that I avail of, is changing, moving from one plan to another. Different choices. So the first question that came up was, is my PCP part of this network? Right? Now, often when I am in the process of making the choice, I may not have all of that information. I don't know what the network is of that new PCP. But having been on the payer side long enough, I know, some of the things I can do quickly is, and where I am in Pittsburgh, I'm able to look up my doctor and see what kind of insurance they accept. And as long as one of my plans are accepted, perfect. And it meets, okay, these are the deductibles, these are the out-of-pocket expenses, etc. Personally, I can make the trade-offs and choose something. But I realize that is a really difficult thing to do, especially for certain groups of people. Engaging the human in their own healthcare is pretty difficult.
Yes.
It's not, if you are healthy, the young and the healthy are invincible or feel they are invincible. That's right. They are not always, and they might have cost pressures. And so, all right, I'm not going to see the doctor. So low out of pocket, high deductible, maybe that's how I make the decision. And then as you move through life, different phases of life, need different services and you change accordingly. But at no point have I seen anyone, and maybe there are others who do this differently, to be able to make a very holistic decision by looking at what is on the screen in front of them. Yeah. That doesn't mean there aren't organizations or companies doing their best to inform their potential customers. Lots happening. And this is where I think one of your questions is complexity a barrier? This is exactly where complexity is a barrier, because the choices and the consequences of making certain choices is not clear when you're making those choices.
Yeah, that transparency piece. You touched on something, though, around, I would call lifespan, or where you are at this point in life. Can you share, or have you seen situations where, because of challenges or complexities in the experience, where a person has disengaged or opted out of seeking services
all the time?
From a healthcare perspective? Yeah.
All the time. And it's not related to, some of it, there is a relationship to kind of their socioeconomic status. Mm-hmm. Some of it could be just related to their own cognitive abilities, given where they are in their lives, that, people are making uninformed choices or completely not engaging in their own healthcare. Yeah. Medication adherence as a general topic is one area that comes up very frequently in my conversations these days, both with payer executives and with doctors where costly medications are not being used. GLP-1s are a great example where a lot of people get them, a lot of people are using them, but there are people who don't fill those prescriptions or bring it and don't ever use it. And that's just one of the most common examples, right? Now think of, this was something that I worked on in one of my previous corporate roles, engaging members with severe mental illness. That is hard to begin with, right? How do you engage someone, whether you are a doctor, a health system, or a health plan? Someone who has PTSD, a combination of these, PTSD, OCD, bipolar disorder, and they might be suffering from, cancer or heart diseases. How do you engage such a person? On top of it, they might be homeless, right? And these normally end up being some of the most costliest patients because they aren't taking their prevention seriously, and they are only ending up in the ER and rising costs, right?
Yeah, absolutely. Because in addition to what you've outlined, there are vulnerable populations that add more to that situation. You've also had some disenfranchised populations who historically have not had great experiences with healthcare. So that's definitely real impacts, real people.
So I want to share, a great example of where things moved in a more positive direction with engagement.
Yes.
Early on in my career, I was part of the University of Pittsburgh system and part of the Graduate School of Public Health, where we had a phenomenal health equity course that was just starting off. And this was several years ago. As part of this program, we started engaging, one of our professors started engaging with Black barbershops. And, that experience really stands out because that's where I saw community engagement in action, personalized healthcare in action, engaging non-clinical community champions. It was just phenomenal. And this was really a model that started in Pittsburgh. All of us, and this was a graduate level course, so all of us, I think there were about 10 or 12 of us, would show up at Mr. Bath's barbershop on the Hill District, which is an African-American neighborhood in Pittsburgh, very prominent. We would be flies on the wall. It was a two-step process where first we engaged the barbers and we educated them, and then we just sat back and saw how they were talking to young African-American men coming in who were at increased risk of hypertension. Mm-hmm. And, there is no other way of getting that level of engagement and really getting the message across. I mean, I have a 17-year-old, so forget ethnicity or race. 17-year-olds are a class of their own. So you're not trying to engage 17 to 25-year-old young men and asking them to take better care of their health. You need voices that they will pay attention to and trust. And that's the other thing for healthcare and for healthcare engagement. Trust is the most important piece. It is, I think there is overwhelming appreciation that it's difficult to gain trust, and not everyone is positioned in this ecosystem to actually gain trust of the patient.
Yeah. But I would think across industries, and it's so interesting that you mentioned that trust becomes the bedrock of why customers at any level in any field will continue to do business with you, because you build that over time. So I want to switch gears for a second, because you've had all this knowledge. You've worked in so close to the traditional medical fields. Let's talk about in your work now, when you're doing a redesign for an organization. What's the one change that you found that's had the most positive impact on improving the overall user experience?
Are you asking about user experience from a digital health engagement, or just healthcare?
Like how
just
does
overall customer engagement?
Yeah, engagement. How does it improve that overall experience? And because I think I would want to say that that's probably going to lead to better outcomes.
Absolutely. So Transparency and taking accountability, I think, are the two key features that I have seen where customers, in healthcare, they are patients, whether you call them patients or members, it's the same human.
That's right.
And whether you're a payer or a health system or a provider organization, it's the same focus is, are you clearly and transparently explaining their options and helping them make trade-off decisions if those need to be made? And second is taking accountability is, if you, customer or member or patient, you need certain pieces of information to make the decision, am I giving you that at the right time and in a format that you can consume most effectively at that time? Yeah. So as an example, if I'm a patient and I am suffering in pain and I'm in the ER, you come back with authorization denied for a certain procedure, I don't have the ability to comprehend that information. I'm going to respond in a negative way. I'm not going to respond, I'm actually going to react, right? That doesn't help.
Yeah.
And this is an extreme case, and we can look at all the extreme cases. The other piece is accountability also means not inundating me, the customer, with multiple pieces of information. Okay? Think of all the pieces of paper you get from your health insurance throughout the year.
Yes.
Now, I will give you the flip side of that as well, is that it's really difficult. This is where complexity is a challenge. Yeah. Because different functions in the payer organization have to accomplish different objectives. And sometimes it becomes, because there are no other better ways available today, it becomes inundate the member with, bombard them with mails.
Yeah, and that's where my mind went, because I wanted to ask you about how do you thread that needle between improving the user experience and compliance, because some of those, those forms are notification, like these are legal requirements that we have to do and don't make it easy. So yeah, I love that you brought that up. So how do you win that tug of war between empathy and the compliance?
So some of it, unfortunately, is the bureaucracy that we find ourselves in today. You're absolutely right. Medicaid is notorious in terms of, to some extent, Medicare too, is what you need to let your member know. Yes. I think some of these need to be handled at the policy level, where you still accomplish your end goals, but you have to think more about, how do I do this in a way so that it doesn't put a cognitive burden on that member? With the technologies that we are now developing, I think some of these situations might be alleviated. Orchestrating communication between your patient or your member and the organization at the organization level is very important. And I don't think that has been done as effectively in healthcare as it has been in a lot of the other industries.
Yeah, you talked about AI and digital and, at the beginning of this, and that point triggers this question around, as we introduce AI and healthcare tends to be a little bit behind other industries. How do you automate in a way that elevates the experience without creating a bad process at scale?
This year, I've been to a number of conferences, mainly focused on health insurance plans, and member engagement was the top of mind pretty much for all of those those conferences. The one thing that became clear to me, it's an evolution. First of all, let's acknowledge that all of this journey that we're going through is an evolution within the industry itself. And we have to acknowledge that a lot of advances have been made. That doesn't mean the challenges have not been created. Right now, one of the biggest challenges is there has been a proliferation of point solutions that accomplish one aspect within the care journey.
Okay? That's right.
And It is a challenge for any organization for the matter, large or small, to be able to manage those multiple point solutions in a way that seems orchestrated. And that requires significant change management, right? Organizational changes, change management, the whole array of everything difficult and challenging that an organization has to do in order to operate. Okay. But the big thing that I have seen this year is the acknowledgement that we need to do better in terms of engaging with and I'm going to just use members as the payer example here. Yes. Right? I know on the hospital side, they're having similar discussions. We need to engage patients better. Because healthcare is one of those things where it's not that you're buying an item and taking it. It's not like going to the Apple store. It's not like ordering from Amazon, right? You get a service and then you pay for it. And both the service can happen over multiple times and you pay for it potentially over multiple times. And then sometimes you pay part of it, someone else pays part of it. So it's not like retail, definitely not. And, we talk about value-based care these days. That puts an added layer of complexity in terms of how people respond to what choices do I have and what decisions do I make. So in terms of just understanding, we are at a point, I think, industry-wise, where we know we need to do better in terms of engaging our customers. We understand the problem. We can define it better. And theoretically, we know what the answer needs to be.
Yes.
In healthcare, when theory meets reality, well, a lot of interesting things happen.
A lot of interesting things. But we talk about the need to balance technology with empathy because, again, we're still dealing with humans.
Yes.
But this takes me down the road to talk about, what sort of leadership mindset is necessary to drive this change that you're talking about.
I have a perspective that may not align with everyone else's. I think at the end of the day, for healthcare, a human-first, empathy-driven leadership is what's going to win the day. Okay? What I have seen happen in some cases, especially with AI, leadership wanting to see how we are using AI, and we are creative humans. We are smart humans. Everyone trying to then figure out, I have a solution, now let me retrofit it to a problem, and in the process, creating more problems. And I wish there are some, I follow Dr. Sachin Jain, for instance, and I really appreciate the perspective he brings in terms of saying, human first. The care is more important, not how it's delivered. And so if you are thinking of how do I use AI and not thinking of what is the real problem I'm solving and can a simple restructuring of the process solve this problem versus do I really need to invest millions of dollars in AI? I think that question needs to be asked more clearly by our leaders. That is not happening.
You may have just answered this question for me, but, I'm looking for that soundbite. We're going to put out a t-shirt, right? So if you could send a message to any provider exec about the customer experience and its role in the delivery of services, what would it be?
Repeat your question again.
So if you could send a message to every provider exec about customer experience, and its role in the delivery of services, what would it be?
Oh, easy. Would you want your grandmother to have this experience? Replace the word grandmother with mother, father, aunt, sister, brother, anything. Because at the end of the day, each executive, it's funny, and I think about this often, we're all executives by day and humans by night.
Yes.
And so with healthcare, think about it. Would you want that same experience for yourself or your most beloved family member?
So what you're really left with is, if you're going to run this from a widget type model and try to get people through as quickly as possible, then you're really running something that's based on systems, right? It's just volume.
Yes.
But what I hear you saying and what we talked about today is creating that system that treats people like humans and puts human at the heart of that decision-making process. And, you know, that quote, that mic drop moment that we just had was, if you think about those who are closest to you experiencing services and delivery as it exists today, I think we can all agree that there's opportunities for improvement.
Huge, significant. You know, one comparison I'll offer, and there are cultural differences underlying these differences. When I seek care in India, if I'm able to pay for it, I will get the best Cadillac care possible.
No.
It's personalized, it's on time, it's everything that I need it to be. That care is still available if I'm able to pay for it. In the US, that is not true for, I would say, 99.95% of residents in the US.
Yeah.
And that really irks me. I think it annoys a lot of us. There are many of us who came to the US a few decades ago, kind of seeing it as a beacon for all things that are scientifically driven, that are geared towards the good. And I think over the last couple of decades, we have evolved in a different way, where some of us have been disillusioned, some of us have chosen alternate paths. And so when I look at what value-based care was supposed to do and what it has accomplished versus what a fee-for-service model is able to accomplish in other countries, there is a stark difference. And again, this is a multi-layered onion. We could probably spend hours talking about it, but I want care. I think this is the best country where care is being developed and should be available, which was a big reason why I started focusing on affordability and accessibility.
No, absolutely. You know, Indrani, I'd really like to thank you for this discussion today, because it's really enlightening to hear about the various facets of healthcare delivery services. It's something that we all have experiences with.
Mm-hmm.
And you know, again, my focus has always been about how do we elevate the experience regardless of the industry. And I think one of the things that you've reminded us of is that there are people who are working really hard. Trust is at the heart of it, and that we should really have humans as the key focus. So I think this really shifts us from a discussion around how do you drive customer experience to really driving a human experience in healthcare. So I'm going to give you the floor. Any last words as we wrap?
Yes. You know, technology is playing a loud role in healthcare today. And there are both positives and negatives to that. I think one of my biggest concerns is that, you know, technology development and deployment is happening at such a scale that the human is getting left behind. Okay? We want telehealth that does something, but at the end of the day, I would prefer the doctor, the PCP, giving me a home, you know, visiting me at my home. Because that trust between me and my doctor isn't going to be replaced anytime soon. It seems to me that we need stronger voices and I'm hearing a lot of, so why I'm really excited is I'm hearing a lot of doctors step up and take leadership roles where they are advocating for, you know, how does care need to be delivered. I think that needs to happen more holistically. And that should be driving how we evolve as an industry.
And there you have it, folks. So our resident expert, Dr. Indrani Halder, who talks about customer experience. If you've liked what you've heard today, please like, comment, and subscribe. We'd love to hear from you. Once again, this is this week's episode of Confessions of a CX Executive, and we'll see you next time.